myself, Dr. Netravati from Bengaluru, welcome you all to this great initiative from Indian Academy of Neurology in the series of Legends of Neurology. All this started with a phone call from Dr. Nirmal Surya to me one day asking me to have this interview with Madam. And believe me, I just had flashback of my first experience with her, 2001, 21 years back. I just finished MBBS, joined as a junior resident at NIMHANS, busy morning, getting ready for rounds, literally running around to do things. And I see a beautiful Kanjivaram sari clad, elegant lady, along with so many people behind her at the neurocenter reception. I was like, NIMHANS director, wow. And here I'm sharing space with this legend, ma'am. Privilege, it's an honor. You're really an icon, and you do not need any introduction. Professor Dr. Gourie Devi, Emeritus Professor of Neurology at IHBAS, New Delhi. She's also an advisor, Department of Neurophysiology, Senior Consultant Neurologist at Sir Gangaram Hospital, New Delhi, Honorary Advisor for Neurology Research, ICMR, former Director VC, Chancellor, Professor of Neurology at NIMHANS, Bangalore. I'm deeply honored, ma'am, and take it as a privilege to introduce you, a great teacher, inspirational person. Madam, welcome.
Thank you, Netravati, for this very lovely introduction. I'm also honored that Indian Academy of Neurology has chosen me as possibly as one of the legends. It's a great honor, and I think I'm going to look forward to your questions. I hope they are not going to be very tough to answer. I hope I'll be able to do the justice what you expect from me. I hope so. Thank you, Netra. I know you have done a lot of background work on this interview.
Thank you, ma'am. Thank you. Ma'am, as you know, we're just going to discuss with you about, we basically want to know about you. So let us start from your childhood, from where you are, your family members, your memories of your childhood. Could you tell us about that, ma'am?
Well, it will take me back to a number of years now that I'm in the 80s. Well, I was born in a place called Anakapalli, which is part of Visakhapatnam district of Andhra Pradesh, in the year 1938, 13th of December. And then my father was in the All India Radio as a central government officer. So we had to move wherever he was transferred, and which would happen every 2 years. So it will be Delhi sometime, Chennai, Trichinopalli, Jalandhar, Calcutta, and so on. Therefore, you can understand how my schooling was, started in Delhi, but we were in a far off place, outskirts of Delhi, no school there. So my mother taught me. She herself, in those years had passed SSLC, very unusual for a woman to go and study. So she made school hours for me. My father would leave for the office, my school would start. 1 hour, every subject was taught by her. And later on, I joined the school. First was in Trichinopalli, St. Joseph's Convent, second standard, I think. We were there for 2 years, then came back to Delhi. There's a presentation convent opposite Red Fort in Delhi, so another 1 or 2 years. Then to Chennai in Church Park Convent. In those years, it was, I would join a course a year in the middle of the year, because when we are transferred, it's not from March to March or whatever. So every time my admission would be based on a written, some questions were given and I would write the answers. And based on that, they'll say, okay, you are fit enough for second standard or third standard. In that bargain, luckily, I had what is called as double promotions. Nowadays, we don't have this concept. In our time, if you did very well in a class, from second, you could go to fourth. So I think I jumped few classes. It's an advantage, of the thing. But finally, it was in Chennai, Vidyodhya Girls High School. It was a Tamil medium school. Just that year, it became English medium. There I joined and did continuously my schooling. That is fifth form and sixth form. That will be 10th and 11th, you know. It was called the Secondary School Leaving Certificate, SSLC. Okay. I was a little underage for that. You know, you had to finish 14 and a half years or something. I was few months short, so I was given exemption to take the exam. Then my father said, anyway, you are going to do inter and MBBS, take 1 year off, because for MBBS also you require certain minimum age, you know. So 1 year, you know, I spent with my parents at Delhi. And what did I do? I read all literature. Take Charles Dickens, Oliver Goldsmith, anything, just anything which came across, I read and read. Then I joined intermediate college in my back home in Anakapalli, and we had the choice of the subjects called biology, physics, chemistry, or maths, physics, chemistry. If you wanted to do medicine, you had to take YPC. So I took that 2 years, I finished. Then I joined Andhra Medical College, Visakhapatnam, the famous medical college, next only to Madras Medical College. It was part of Madras province, you know, that time, before that. So that's where my MBBS career started in 1956 batch.
So nice, ma'am, imbibing all the cultures from different places because of your father. And then getting double promotion, my God, I don't think we can even envisage that in this generation. Great, ma'am. What about your college memories, ma'am? What about?
Yeah, college, the Andhra Medical College, very strong faculty staff, very well-known professors. We were about 125 students, I think. 25 or 23 were girls and others were boys. You know, there was a lot of separation of the girls and boys in those years. The first two benches in every class would be reserved for the girls. Okay. So the boys would sit behind us and we are in the front two rows. And 5 of us were great friends, girls. We went by the abbreviation of GRUMS, GRUMS. Gourie Devi, Uma, Malati, Ramana, Sita Lakshmi. Yeah. Out of that, 4 of us are here in this world. Only one left very recently, but we have been in touch all these years with the meeting once in a year or 2 years. But great friends. I think all of us were fairly good in studies, but also very mischievous, you know, trying to read the chapter before the professor and pretend innocence and ask questions, you know. You know, all those things we did. We had a lot of fun, but very serious people too. So this finished, we had a 4.5 years course in those years. And internship was introduced for 6 months and house job for 1 year. So actually completed the house job in 1962. Some notable professors, I remember, Professor Subhadra Devi, you know, gynecology obstetrics professor, the way she would give a lecture, you know, no mics in those days, huge halls, people used to talk. And then Professor Govinda Reddy and Bhaskar Reddy, they did, you know, even under those primitive conditions, they worked on what is called chotta cancer. Chotta is actually a cigar which is burnt, and the burnt end is put in the mouth. So the oral cancers in Andhra were quite high. And they found out the cause. It's come out in various books. So we were very, very enthused by this. And I was somehow good in pathology. I got 2 medals. So then I applied for MD pathology. You know, I joined the course. And then after 3 months, my father called me from Delhi. They were still in Delhi. And then he said, no, change to any other discipline. I read in the paper today, some doctor doing autopsy, he died. So you stop pathology. You know, I don't know, it was very emotional. I'm the firstborn child. So then I said, I went and told the principal. He said, you take medicine, anyway, you're the best outgoing student. The choice is given. So then I joined medicine there. But in April 1962, my father told me there is a new institute which is established in Delhi called the All India Institute of Medical Sciences. I've got the forms. I'd come to Delhi for some, maybe vacation. He said, you fill up this. With great grumbling, I said, what is this? I don't want to shift, lose all my friends. He said, no, you better go. I did it. And 2 months later, he called me. He said, you got the seat. You better leave Visakhapatnam and come. I literally wept that day, Then I went to my principal, TVS Murthy and Dr. Raghunathan. I said, what should I do, sir? I've been a student here. He said, don't be stupid. It is supposed to be a new institute with lot of new type of approach. You must go. So that's how I came to Delhi, back to Delhi and to AIIMS in 1962. And it was a great eye-opener, People who wrote the textbooks used to come there. Nobel laureates came there, And it was so inspiring that the postgraduates were asked to present their thesis subject to these great people. Sheila Sherlock, I think you remember, Helen Taussig, all these people had come, Denny Brown, I keep forgetting so many, and also Dennis Williams, neurosurgeon, neurologist, of the top cardiologists, cardiac. I think AIIMS was something which is remarkable. It changed my whole outlook to academic medicine, not just exams and studies, but how to go ahead further. So this is how the movement from Andhra, Visakhapatnam to the capital city, the best institute in the country, AIIMS, New Delhi, was my destination here.
Ma'am, really nice to know. I think drums, that is really nice. Having such nice friends at that time and maintaining it till now, it is really great. And nobody will even guess that you were mischievous trying to read even before the class starts and ask the questions. I think, but that is expected from you.
Thank you. Yeah.
And I remember once Dr. Nalli Madam, when she was I think introducing you, she had told it was a loss for pathology and a boon. And we were, neurologists were actually very benefited that you left pathology. So I think thanks to your father for that. And all these people who have laid foundation for you, really nice, ma'am. So what about that, ma'am? After that, what happened?
In AIIMS, yeah, I did my MD medicine. As a matter of fact, my thesis was in gastroenterology. Pancreatic function tests, I used to pass the tube, take biopsies. But then what happened was Dr. James Austin, he was from Colorado, Portland. He came from there. AIIMS didn't have all the faculties at that time. There was no neurologist. So he was invited as a visiting professor or associate professor. He is the person who worked on aryl sulfatase, a deficiency in metachromatic leukodystrophy, very well known, James Austin. He used to teach us clinical neurology. And coming from US and emphasizing so much on clinical, how to examine a myasthenia patient. That was, I'm talking about 1963, 64, when none of these things were very popular or whatever. And he was such a good teacher. We used to have outpatient clinics. All the epilepsies, everything was taught. And many of those times, we were only 3 students in each batch at that time. So, and MD was 2 years course, not 3 years like now. So, all 6 of us, I think most of us went to neurology, thanks to Dr. James Austin. Then the Professor Birmani joined, Dr. Baldev Singh, the Papa Neuron as we call, he joined, then department was set up. DM neurology started at AIIMS in 1966. So I'm the first batch, and if you go to AIIMS Professor of Neurology room, the list of DM neurology students, you will see my name probably as the first one. 1968 was the exam. At that time, only 3 centers in the country had DM neurology: Madras, Institute of Neurology, and Vellore at AIIMS. So finished DM in 19 1968, I worked on 11 hydroxycorticosteroids in epilepsy, experimental model. I learned how to do stereotaxy for a monkey. Dr. Joseph P. and Tandon taught me how to do, and then collect the samples and so on. That's, of course, history. Then that finished the AIIMS sojourn and the training program. But during that period, unlike what is happening now, we used to be called as registrars. Say we had to do angiograms, carotid angiograms by direct puncture. Even brave of us did vertebral punctures, vertebral artery. It's very tough, I know. Extreme hyperextension and pneumoencephalograms, cysternograms. You wouldn't think of all those things. And some of them were terrible experiences, both for the patient and the doctor. So, but then in those years, that was the duty. And even at NIMHANS in the years, in the 70s, the residents were doing many of these tests. After CT scan came, these horrendous tests became, something of the past. And it so happened with carotid angiograms, we had to measure look at what is called as the Sylvian triangle, or the middle cerebral artery, the course. And then if there is an upward deflection, it is a temporal lobe tumor. If it's a downward deflection, then it is some parietal tumor. And then I wanted to develop some normative data. And I wrote up a paper. I never thought they would be accepted. Measurement of anterior, middle, posterior cerebral arteries, etc. Published in Neurology, India, 1969. In those years, this was the only way you could make the diagnosis. The shift of the arteries, because in a tumor, you cannot do pneumoencephalogram, you have to do ventriculogram, and that was very tough. So as an offshoot of these terrible procedures, but we got enthused about doing, you make the best thing out of whatever is existing, isn't it? So that phase of training program was over. MD and DM neurology.
I think main thing is the emphasis what you have laid on clinical neurology, because of now we rely so much on investigations and CT scan, MRI, but at that point of time to learn so much in neurology, especially with all those difficult procedures, really nice. Ma'am, I'll just share a few photos of a few things, and I would like to see your comments on this. Just sharing it.
Yeah.
Yes. You remember this one?
This is myself taken in a studio, I understand, in Delhi. It's supposed to be a very upscale studio. My father was, because first child, daughter, all these things which happen. And I remember I heard that from my mother, my frocks would be stitched in Connaught Place. We used to stay in Old Delhi somewhere called the Basra Tailors. I think some Delhi fellows may remember. It may be not there now. So, in these are all British days, no? So nice georgettes, lovely, lovely. I still vaguely recall those prints, I don't know if you've ever seen those. So those would be stitched and worn.
So these people sitting are your parents, ma'am?
Yeah, the second photo, it's overlapping with our this thing. Let me minimize. This is my father, my mother, and grandparents, my mother's parents. Yeah.
Okay, nice.
Now, how do I get back to the...
Shall I go to the next photo, ma'am?
Okay. I'm on the photos, right? This one is, as I said, the best outgoing prize. There was what is called the Silver Jubilee Celebration Committee Prize, and it is 1961, I think. Name.
Yes,
Yeah. Right. 1961.
Dr. Gourie Devi, 1961.
So it is best out. What they do is the entire heads, all the heads of the departments, starting from anatomy to medicine, sit with the principal, and then they decide how many prizes, medals, distinctions a candidate got, and then they decide on a particular person as the best outgoing student. There was a neck-to-neck race with a boy next to me. So, that I think it was a holiday meeting. We went there, and only 4 girls were with me, standing with me, and with the boy, I think 30, 40 people. They're all waiting. Who will get the best outgoing prize? And then, of course, you can see the reactions, expect the reactions. Okay. So that
The
was
legend was already there to be seen by everyone.
that was very, when you are young, these things matter so much, but now it's something different. Yeah.
True, ma'am. True, true, true. I'll just go to the next one.
This one, the Medical Council of India has these BC Roy Awards, and every year on his birthday, these are confirmed, but sometimes there's a lot of delay. And in the BC Roy Awards, there are awards for called the major category and the minor category. Minor category is for a specialty. Somebody in neurology, cardiology, nephrology, they get. Major category is everything together. Okay. So actually, it was awarded in 2001. The award came to me, but actually the physical award occurred only in 2004. In a way, it was good because, Abdul Kalam ji gave the award. It was in Rashtrapati Bhavan, the function, and this was the thing at that time, 2004. Yeah.
So this is one of those awards which many of them aspire, and to get it from Shri APJ Abdul Kalam.
I know.
Really a big honor, man. Really a big honor. You remember this, ma'am?
Yeah, this was a surprise to me. One day a mail came from the International Federation of Clinical Neurophysiology that you have been awarded this oration. I said, some nomination has to go, no? Something has to go. So I immediately called up 1 or 2 people in India. They said, we don't know. Then I said, is it some fake mail? We never know. But then I went and looked at it, it was detailed. Later on, I came to know the committee sits, and looks at the publications particularly, and then they give this award. And I was thrilled to know that it's the first time somebody from this part of the world, Asia, is getting the Triple Award. So it was indeed a most unexpected one. And I had to give the oration in 2018 in Washington, and this was the function.
This was the first to be given in Asia. This even I did not know when I was trying to do research. Oh, really nice, man. Really nice.
Thank you.
Really nice.
Clinical neurophysiology. This was at NIMHANS.
Yes.
The Neurological Society of India had its conference. You can see the president standing of the NSI behind Dr. Kalam. Okay.
Yes.
He's a neurosurgeon. And then Dr. Kalam was, I had the honor of being again felicitated by him. And this picture I like when he puts namaste to me. I said, sir, I cannot sit down like this. I have to stand up. He said, no, you sit down. So this is from NIMHANS only, Neurocon.
Ma'am, one thing, I was a little selfish in putting this photo. This is me here.
Oh, sorry, I didn't notice that. I'm glad you told me that. Okay, yeah, now I see. Okay, you were handing over these shawls. Okay, Netravati. Now I will remember that. And Satish Chandra is here on this side. Yeah.
Yes.
Very nice. All these memories are,
Yes.
Yes, these are different photos. If I put, you can see what photo I'm showing? No.
This one? This one?
The left side lower one,
Yes, ma'am. Lower bone.
Yeah. That is Professor P.K. Thomas. And this is in Japan.
This one. Correct, ma'am?
Yeah, that's correct. Absolutely. And I'm sitting behind. You see, as I have not gone to the Commonwealth Fellowship thing, I was on a Commonwealth Medical Fellowship, 73 to 75 when I was in Saptajang. And first year was in Newcastle upon Tyne, mentored by Dr. John Walton. Now he had become Lord Walton. He's passed away very recently. The second part was in London at the Royal Free Hospital, where P.K. Thomas, is a real expert in peripheral neuropathies. So I learned nerve conduction, single nerve fiber teasing, which I used it later on for leprosy work. And he was going to Japan to investigate subacute myelooptical neuropathy. And I was just about to leave for India. He just asked me one day over a cup of tea, have you seen any patient of small? I said, we used to call him PK. I said, PK, I've seen possibly one patient at Saptajang. I'm not too sure. He said, then you are a better expert than me. Come along. So that's how I got a Japanese trip. We went from Tokyo to Kyoto to Fukuoka, many cities across, examined the patients. And he said, we will take EMG machine with us. So Medilec company brought the latest one, and I was already working on EMG nerve conduction. So he would tell those Japanese people, Dr. Devi will now do the conduction test. So sometimes the sensory potential, maybe I could better one or whatever. So this was investigation of small. In that time, 1970s, there was a large number of people in Japan who were taking clopidogrel, huge doses over years, and they developed myelooptical neuropathies. Fortunately, in India, we are never prescribing such high dosages. So occasional patient only. I think I went on collecting. I had about 8 or 9 patients, very mild. So this was in Japan. The photo above that, if you put on Dr. John Bolton's face on the left, yeah. So this is the ward round in the pediatric neurology ward. Thanks to the Madras PVS and Krishnamurti Srinivas, any dignitary expert used to come to give the oration there. Dr. Srinivas used to direct them to Bangalore, NIMHANS, because we were government institute. We had difficulty in hosting people, getting people across. So that one of the visits, this was in 1982, I think. John Walton came, and you can see Dr. D. Nagaraja and Satish Chandra. And the next photo on the right is all the department staff. I think you can recognize almost all of them, but very young, And you can see Dr. Narayan Reddy, the director to my right. Yes, that's right. And Dr. Virendra Kumar standing behind him. Dr. Satish Chandra, just the head part you see. Dr. Tally at the topmost part, left side here. Okay, there are many others here. Dr. Suresh Rao Arur on the left side of Dr. Walton, in the front, left side of Dr. Suresh Rao Arur. And Sridharan from Chennai, he was here for a short time. Ram Manohar at the back, and some are hidden, of course. Okay? So this is again a very sentimental photograph.
So many, I think most of them we can recognize. So many.
You can recognize, yes.
I think this is DN.
Yeah, D. Nagaraj is there. Yeah. And I think the back with the mustache and all must be Nair, Hindi Nair. No, to the extreme right. Yeah. The one you pointed out before is Dr. Pratap Chand.
Okay.
Just go back next to Dr. Swami, Dr. Pratap Chand.
Okay. Nice, man. Nice to see all of these. I'll just go to the next photo now.
Yeah, sure.
I think now we have come to the publications.
Yes.
These are your publications which I got. I think you're recognized by these, and people should hear about this, how you have done all this work.
You see, the first few cases, maybe 3 or 4 I saw in Saptajan. I did not know what to call them. He was young boys with wasting of one hand, and I did some EMGs, but in the meantime, I moved to Bangalore. And Bangalore, we were keeping a good search for when we could see such patients. And over the time, there were few more patients. And Dr. T.G. Suresh, you'll see in the first paper,
Yeah.
that's the one, Archives of Neurology. He took this as the thesis for DM. He was a 5-year batch. And we documented everything. But then we didn't have a word. By that time, only we came to know that Hirayama has described it in a different title, juvenile spinal muscular atrophy, etc. But we said, I told Suresh, we have to give some name to it, which is catchy. So went to the library. There's a Stedler dictionary there. So we looked at melia, limb, mono, single, amyotrophy. I thought it was a good word. We named it, christened it. And at that time, Dr. Gadjuset, the Nobel laureate, came, and showed him few of these patients. He said, I've never seen such patients. Then I told him this name, Oh, he said, I like this word. So somehow it went in. And then we went on looking at various aspects, the CT, the long-term follow-up. Then Dr. Nalini took over after T.G. Suresh left. Then I was asked to write this chapter in the Winken and Bruin series. Later on, it has been changed. The editors have changed. So this in this volume, my chapter is there, monomilic amyotrophy of upper or lower limbs. I've given the complete, review like of that time, 2005, I think. Yeah, 7 it got published. 2005, 6. So later on, of course, we have understood few more things. Even now, we are trying to work on the genetics, because why it is so much, so obviously seen in Japan and India, Asian countries, not so much in the West. So it's worth looking at. We haven't really pinned down a particular gene, because mostly they are sporadic, occasional familial cases only we see them. But now that we know the clinical progress, how they do, we have become more confident, particularly after the paper on long-term follow-up. We followed them for 15 years and even beyond, and saw that it progresses generally up to 2 to 5 years, and after that it remains stationary. Of course, more new developments have come in MRI. Now you know that. So this is a single limb atrophy, mostly upper. The lower limbs were not described by the Japan, whereas in Chandigarh, wasted leg syndrome, Chopra, Prabhakar described, and it's the same illness. They thought the farmers squatting for a long time in the fields would get this, but our patients were not like that. It could be young person. Some patient went for army checkup, and they said, oh, your leg is thin. He was not even aware. Or the tailor detects this, when they go for measurements. So sometimes it's so incipient, the patient doesn't know when it started, particularly the lower limb one. So this is a lot more can be said, differences between post-polio, progressive muscular atrophy, and motor neuron disease, and so on. But that will be a lecture by itself. So I won't go further on this.
To discover an illness, and now for many of us, this may be a spotter when we see, but so much of hard work could have gone in recognition when nobody else knows, to recognize, to make out what it is. And now coming up to the genetics level, I think that's a really nice thing what you have still carried on, ma'am. Really nice. The next one I'll just go.
Yeah. I was quite interested in leprosy, because when I was working in Saptajan, there is a leprosy ward, So I started getting interested what types of peripheral nerve involvement they have. And fortunately, skin biopsies, all these were done because it was under the dermatology department. Okay, so slowly, I started working on the nerve biopsy, single nerve fiber teasing, which I learned with P.K. Thomas. I used to take the help of AIIMS, Department of Anatomy, because they had all the equipment. So after office hours in Saptajang, about 5 o'clock, I will go there. Then 7:30, under the microscope, you have to tease the nerves and take out each fiber and put it on the slide and measure internodal length and the fiber diameter. So this paper, which you are seeing in Annals of Indian Academy of Neurology, this was a Baldev Singh oration which I gave. There I've included all the work which was done at Saptajang and subsequently at NIMHANS also. Dr. Dharmendra is the doyen of leprosy in India. He was in Delhi and I used to visit him. He once told me that during the British times, these Gurkhas used to carry a lot of weight on their head and come down the hills. And many of them had thickened greater auricular nerves. So any thickened greater auricular nerve was dubbed as leprosy and they were removed from the job. So he asked me, as a neurologist, can you tell me whether it is a normal thickened nerve because of carrying heavy weights? Could be some kind of a change, physiological change, or it is pathological. So then I said, let me, with my little knowledge, whatever I had, I did this nerve conduction and looked at controls, stimulating the nerve and recording the potential and seeing that it can be normal. Even I had a couple of young people who didn't have leprosy, but had thickened nerves, thickened greater auricular, no other nerve. So we could manage that. And that is the paper. And in the other paper, which I have not written about, dorsal cutaneous branch of the ulnar nerve. When you want to do a biopsy of the nerve, ulnar nerve, doing it elbow is not a very nice thing. It's a mixed there, motor and sensory. If you could get only a sensory branch, it would be useful. So I picked up this dorsal cutaneous branch. We can just palpate it on your later part of the hand. I've given those photographs in this paper, and you can do a sensory nerve conduction and very easy to do biopsy. You just lift it up and do a little cut there, and you get a good histology. I think these are the works and phrenic nerve conduction which I did in Saptajang and Gillian-Barry. Maybe I think the IF International Federation of Clinical Neurophysiology might have thought something worth, I suppose. So anyway, leprosy. Then I told Dr. Dharmendra, sir, all thickened nerves are not leprosy. There were some very nice editorials also at that time coming. Our thickened nerves means leprosy. The thickened greater auricular nerve, does it mean leprosy? So I think it's not. So some other diseases may have thickened greater auricular, Refsums, yes. Sometimes CIDP, very rarely.
Yes.
Yeah.
Actually, when I was trying to look into your research and everything, there are so many, but I have just put few of them where you have been integral in either starting or discovering it and making the world aware of it. So I'll just go to one more publication. These are actually 3 publications. These are 3 different areas where you have worked. It is, but they have been a landmark paper at that point of time and still a benchmark for many of us till now. So these are actually 3 different patterns. One is on epidemiology, tuberculosis, Madras MND, but here you had a pivotal role in establishing, especially the neuroepidemiology, I think came forth only after this study, I think. Would you want to tell something on these?
About neuroepidemiology? Yeah, it's my, I would say, great interest. It developed when we were going for the satellite clinics. I was going to Gourie Devi with the team. I think it still continues at NIMHANS. The team would go. Then I told the group, why can't we do some study when we are going there once a month? Cannot we I'm not an epidemiologist. Fortunately, we had the social work people, Ian Rao and Prakashi Rajaram. We developed a questionnaire. There's one paper before this, which is called the Gourie Devi prevalence. It is published in the motor neuron disease book. That we did it off and on or using common sense, as it were, using field workers to detect the cases based on symptoms, okay, checklist of symptoms, and then we would examine and confirm the diagnosis. When I discussed with Bruce Schonberg, who is an expert in neuroepidemiology, he said, this is the technique we have been telling the world over, that it's a two-phase study and you have done it exactly how it should be done, you know. So I presented this in the 1984 International Motor Neuron Disease Conference at Bangalore. And many people were there. Kurland, I don't know if you have heard about him. He's a great epidemiologist. Gadjusek, all these people were there. So it gave a great stimulus. I said, okay, we wrote the paper, but should we not do a planned study? Fortunately for me, Dr. Gururaj, epidemiologist, joined NIMHANS. That time, Satish Chandra got very much activated into this, and Subhakrishna from the statistics. Now we developed what is called as the NIMHANS questionnaire or ICMR. We got funds from ICMR, and this was a systematic study done of more than 1 lakh people, both the Bangalore urban and rural. And using the questionnaire, we determined the prevalence and gender, age, what type of disease, which is common. And then we published this. Subsequent studies, they have always, majority of them have used our questionnaire. And some people call NIMHANS questionnaire, somebody calls Gourie Devi questionnaire, I don't know, as they please. They do minor modifications, which they are. We have written also a manual of this. I still have a number of copies we keep distributing, how to go about doing it, and what are the various terminologies which we use here. So this study gave us approximate prevalence of neurological disorders. Obviously, we are not included infections, head injuries. No, we have taken common neurological disorders, as it were. So this became really a landmark paper and cited both nationally and internationally. That's the story of neuroepidemiology. I'm very fond of this because it gives you a lot of information. Your planning, healthcare planning, what equipment you need, how much of manpower you need, what level of manpower, all that can be determined based on the epidemiological data. That's it.
Add anything on this, no?
Hyaluronidase. You see, nowadays it is becoming very much less relevant because times have changed. This again, I started in Safdarjung. One patient from Agra used to come in a wheelchair. He had TB meningitis and followed by paraplegia with bed sores and all that. You know. I don't know why he landed up. Then I remember when we were interns working in pediatric wards in Visakhapatnam, we used to give hyaluronidase subcutaneous, you know, and then inject the fluid for the absorption. So I said, what was that, you know? Then I went to the library in Safdarjung and looked at hyaluronidase spreading factor, it was called. So this man, I tried initially hydrocortisone, it almost a dry tap, you know. The second patient who came, you know, he told me I could use him as any experiment and do. Okay, so first time we took it, it was not possible even to get a drop. But there was an anesthetist also standing with me. I said, I don't know the reactions. In case the hyaluron, it's a protein substance, something may happen. But fortunately, nothing happened. Little bit of fluid I could inject. Next time from complete dry tap, few drops came. That's all. Okay. Then the second patient came. I remember she was a Tamilian lady. And then here I have there's a publication in Indian Journal of Medical Research before this, where I've written the protocol and how We gave efcorlin in the beginning. First 2 injections, yes, the proteins came down, but subsequently, again, it increased up to gram or more than that. Then we intervened with hyaluronidase. Subsequently, all the serial sequential lumbar punctures showed a reducing protein. So that gave 2 or 3 patients like this. After going to NIMHANS, I think NIMHANS gave me like a springboard, Satish Chandra had to do a DM thesis. So I said, would you like to do? Yes. You see, in those years, our anti-tubercular treatment was different. That we must remember. It was streptomycin, ethambutol, and thiostine. Yeah. 3. None of them were really sidal drugs. They were more static drugs. And streptomycin, we used to give pyrazinamide, ethambutol, not rifampicin at that time. That came later, only streptomycin. So I think they were not bactericidal. They were not the ideal anti-tubercular treatment combinations. We used to see very often these cases. Anytime you would walk into the ward, you'll see 1 or 2 patients like this. But over the years, much better anti-tubercular treatments have come. Fewer patients, but recently at Gangaram, from the neurosurgical department and neurology, they have asked me. And here also we have given intrathecal hyaluronidase. One was a patient from abroad who couldn't walk at all. We started at least, after 3 or 4 administrations. So the relevance in the current is much less compared to what it was that time. So then we wrote up this paper in Journal of Neurological Sciences, attracted a lot of attention because, you have to do the best at that time under those circumstances. You give, obviously steroids are always given, both oral and then intrathecal also. But despite that, the arachnoiditis progresses, then we give this. There are certain limitations. There shouldn't be active infection, more than 100 cells. And then it should, if it is too long a period, 3 years or 4 years, then it may not work. Maybe in the first 1 year, the results are better. That's what I have been telling. Thiacetazone was the drug. Sorry, now I remember the name. It was streptomycin, INH, and thiacetazone. Sorry, not even rifampicin. Ethambutol all came much later. Yes, these were the 3 drugs only with steroids, oral steroids. So you see what was happening in those years. And today it is so different, isn't it? We do still see, I'm sure you also see arachnoiditis, but not as much as before.
I think these have been mainly where there have been a landmark studies what you have done, ranging from peripheral nerve, neuromuscular, tuberculosis, neuroepidemiology. And though all these have been there, I think most of us know that our family is the biggest background which shapes us as well as which makes us what we are. So this is another one which you have done mainly on the motor neuron disease. And this has been published, I think nowhere else this is available. I got it from you only, ma'am. This
I have few copies with me, which are very precious. Oxford IBH published this from Janpat, Delhi.
So I'll just go to the next one. So this is basically about your family pictures, which I could get it. So would you want to tell anything, ma'am?
The left top one is my 75th birthday.
Okay.
So there was a get together. My brother, how do I point out? I can't point out from here, right?
Is this the person?
Where are you showing? The left top?
Yeah, left top. Just above you, just above you?
Yeah. One brother. Next to him is my nephew. Next to him on the left side is my brother-in-law, Krishnamurti. He is professor of physics at Indian Institute of Science, retired now. And my sister is sitting on my right. She is also a physicist. No, on my right. Raja Lakshmi. They stay in Bangalore. And, she also worked worked in Indian Institute of Science for some time. To my left is my another sister-in-law. We are here together. And the next one is Madhu, my another sister-in-law. This brother, I think her husband, my youngest brother, is standing behind her with a beard. And his daughter is to his right side, very small photos, you know.
Yeah.
And in the extreme left are the sons of my other brother, whom I showed in the center first. Okay, Karthik, Vinay, they're all grown up. They have children of their own now. So, then the next photo on the right is my 80th birthday.
Oh, okay.
Yeah, at Pench. It's a very nice resort, sanctuary-like. We went there all the way. And the same group of people are sitting. You can recognize them now. On my either side are the two brothers. And then that's myself here. I have one more brother, younger to me, but he's in Canada. He is expert in limnology, lakes and freshwater purification. He's not in India now. And behind, next to on my left is my youngest brother. He's an architect. He lives in Delhi. No, on the left, on my left. Yeah, he lives in Delhi. And his wife is Madhu Agarwal. And next to my brother is the son of my other brother, who's sitting on my right, Karthik. He has got a startup in Bangalore. And next to him is my brother-in-law, Krishnamurti, and my sister, Rajalakshmi. And if you go to the above, it's the daughters. Madhu is standing there. Yeah, she was not. These are the nephews. So we all gone there. It was a very nice holiday in Finch. This was in 2018. Yeah.
So nice to join together and celebrate the
Yeah,
birthday.
always you know that.
It makes you feel so loved and so nice, really nice. And
I have an excellent support system.
yeah,
Being single, it's not easy. But
yeah.
brothers, sister, nephews, nieces, all of them.
Yeah. Ma'am, we have discussed on your publications, on your family, and I think very few people know about your hobbies. And this is one of the rarest photographs, I think.
I know. Well, when I was in England, I found, very famous neurologists having very strong hobbies. Somebody was sing in the church on Sundays. Somebody would play an instrument. I said, what is it I can do? When I was in intermediate, for a brief period, I learned Veena in my hometown. Then after coming to Delhi, the thing all, not possible. After coming back from England, I went to Chennai and got a Veena teacher. They have to select the Veena. This is called the Tanjavur Veena. So I brought it all the way to Delhi in 75. It stood in one corner, no teacher. Then I moved to Bangalore in 77. I found a very nice teacher who would agree to come to my house, a lady, Kamalama. So for almost 15, 18 years, twice a week, she would come in the evening after my work and come home. I had another Veena for her and learned from the very beginning, Sarigama to Kirtanas. But again, now after retirement, it's gone. I hope Veena are still there, but you have to tune them. It's quite a tough job. And with seasonal variation, the wood expands and contracts. So you have to be careful about that.
When I was researching on your hobbies and all, I think you mentioned to me also when I was speaking to you about you being a badminton player.
Oh,
And you had played with Prakash Padukone. I searched in the health education department of ours. I couldn't get a photo. I wanted it very badly, but I couldn't get it.
So you see, I used to, yeah, in our family, everybody plays shuttlecock. Okay. In Madras, in those years when I was in the school, it was different badminton called the ball badminton. It's not seen anywhere. There are 5 people in the court. Okay. 2 front, 2 back, 1 center. And it's a yellow ball. So we used to have inter-school competitions. And I was the center. Center, you have to cover the front's mistakes and the back's mistakes. It was very interesting. Then after coming to NIMANS also, there are a number of faculty people. In the evening, we used to go and play badminton. So that was in the old Ashwini Hall. Later on, when the new thing came with wooden flooring, we invited Prakash Padukone to come and inaugurate. And just for the fun of it, played. And he leaves the ball, no, he doesn't strike it back. So that was fun. That was the inauguration of the gym and other things. Okay. But we used to play regularly. I mean, at least twice or thrice a week, some faculty would come and youngsters would come. Singles or doubles we would play. So that's it. Even now, I think they are quite active, I guess. Yeah.
Yes. Yes. So we have looked into your journey through all the photos of yours. So you can see that how elegant Madam has been over the years. Still, the radiance can be seen as Ma'am is speaking to all of us. Ma'am, at this juncture, I would like to stop this one and ask you to give some message to the young neurologists.
Well, I think I have to get messages from the young neurologists because I find them, very knowledgeable and very confident compared to what I would think of myself in those years. You see, great advances have occurred in neurology, in every subspecialty. While you people are not facing those challenges of doing angiogram, pneumoencephalogram, but you have a tougher job. Each aspect of neurology has expanded. Movement disorders, stroke, it's just impossible to keep in touch with all of them, leave alone the one subject which you are interested in. So that is a great challenge for the young neurologist, apart from doing general neurology. That is my strong message. Please don't leave general neurology. Specialize in one area or 2 areas which you have a desire to do. But please, general neurology is the mother of neurology. So message is, yes, please go ahead and do research, trying to fathom into its secrets of the disease and identification of patterns which others may miss. Your eyes may see something which others have missed across the world. So be always alert to it. But basically, advice is general neurology, particularly when you are teaching or practicing history taking. Dr. Baldev Singh used to say, my professor, that neurology is history, history, history. If you have doubt, go back to the patient and ask. I think some secret will come out. And as William Osler said, listen, the patient is telling you the diagnosis. Sometimes we don't spend enough time to listen to the patient. We just ask the question and then next question and so on. So history taking, a careful clinical examination, I think will avoid to a great degree unnecessary investigations. So I think that is the thing. And I would say, pursue whatever you wish. See, the work is there, the stress is there. You can either be happy doing the work or grumble and think it is a burden. So anyway, the work doesn't change. So it depends on one's attitude. Do it with pleasure, the work becomes a pleasure. If you think it's a burden, it's a burden. So enjoy what you're doing. I think I enjoyed that. Sitting in the OPD. Of course, you grumble sometimes, lengthy hours. But going back, you learn so much. In Saptajang, I was single neurologist. Every day on call, 24 hours of the day. But I learned so much. I know it was very painful, very exhausting, but then somewhere like a Jawan or military, you have to get yourself trained. So enjoy what you're doing. And please don't forget general neurology. that is my important message. I think you're all very smart and very clever, lot of information, knowledge. Please go on with that and go on to research, build up, cross the barriers between clinical and basic sciences. There used to be strong borders between and barriers. I think nowadays we are overcoming those. Collaborative research is the answer today. No single person can do research. So it is important to have networking, collaboration with different different specialists and specialties. I have learned that at NIMHANS when we worked on Japanese encephalitis, it was neurovirology. When it was muscle and nerve, it is neuropathology. And even Japanese encephalitis, neuropathology, Dr. Shankar, muscle, Sarala Das, Ravi in virology. And when I came to motor neuron disease, the cell culture model giving ALS, CSF to Professor T.R. Raju, neurophysiology. I think we could, in NIMHANS is a place where you can cross these boundaries very easily, talk to each other across the table, and I'm sure you can pursue. Not only at NIMHANS, across the country, you can do a lot of research. And one small thing is, there was a very nice saying, which I like to quote. The sea is there. Somebody gets snails, somebody gets fish, others get birds, some others just wet their feet and come out. Life is like that. You choose what you want from life. Life is sea. So whether you're going to get the fish, or the snails, or something else, or the birds, depends. Your choice. Okay. So that will be my small little message to the youngsters who are very good, who are excellent, outstanding.
Ma'am, such strong messages, emphasis on clinical neurology, emphasis on general neurology, though we are trying to subspecialize and work with passion, with pleasure. I think though you said all this has so much of meaning and relevance even now. And the final one, what you said, the sea and the fish and the pearls and the wetting your legs. I mean, has such a great message. Thank you, ma'am, for being such a nice sport. Now, we have a message from few of your students whom you have been a great inspiration. So can we have this small video, please?
My most beloved teacher, Madam Gourie Devi, you have been an impeccable and indubitable mentor and role model to me and to several hundreds of doctors and neurologists. You inspire us every minute and every day with your dedication towards neurology and research. It has been and is hard for us to match your zeal, enthusiasm, and motivation. One life is not enough for us to match your qualities. We all pray that you will continue to inspire us forever in this life.
An impeccable work culture, ethics, critical and analytical thinking, a 360-degree approach to patient care, inclusive of and considerate of socioeconomic, rehabilitative strategies, development of an institute, a visionary, a dedicated researcher, a mentor, a beacon, a lighthouse for students are all words I can put in place for my teacher of teachers of neurology. Even they fall short. She continues to inspire and is none other than Professor M. Gourie Devi. Not just academics, yoga, Veena, mindfulness, and a healthy lifestyle and life choice are other faces. Number in neurology without her. Thank you, Madam, with gratitude.
It is indeed a privilege to say a few words about Madam Gourie Devi. Madam is truly an inspirational figure who is a mentor, good friend, and philosopher, all in one for me. Because of our encouragement guidance, we could achieve whatever we could in the field of ALS. Thank you so much, Madam. Wishing you all the very best.
Hi, I'm Dr. R. Srinivasa. I'm one of the oldest students of Professor M. Gourie Devi since 1975. It's a great pleasure for me to talk about our madam. She is an excellent teacher, great motivator, and she has shaped hundreds of students with her constructive criticism and imparting the zeal in learning the neuroscience. She has been a great idol for many of us, and her perseverance has immensely impressed us. At this juncture, I wish her an excellent health to keep going on, inspiring hundreds of neurologists.
And you want to tell something to them?
Just impossible. My God, so touching. So this thing, never knew what they think. I'm really honored and absolutely moved to tears, as it were. Thank you for all the effort. Great messages from all of them. Thank you, Netra, for doing this.
It shows how much you are an inspiration to such. They themselves are great people in their own, and all of them, you have been a great inspiration. Thanks a lot, ma'am. At this point of time, I would like to end this. Thanks, everyone. Thanks to Indian Academy of Neurology for bringing us this and making us aware of all these legends of neurology. Thanks, Mansi, for the recording. Bye, everyone.